We are pleased you joined our session today, and I'd now like to introduce the New England MHTTC's Education Coordinator, Dana Asby, who will review today's agenda and provide some opening remarks. Dana?
Thank you so much, Martha, and thank you everyone for being here. This is our closing session for the Healthcare and Educators Addressing and Reducing Trauma Collective webinar series. We're so excited to be joined by one of our Heart Collective members, John Crocker, as well as several of our Childhood Trauma Learning Collaborative fellows and ambassadors. We're going to start the day off with overviewing a few national frameworks and resources that might be helpful to you to develop and refine your comprehensive school mental health systems. Then we'll hear about a community-based organization's efforts in early Head Start and community schools with Julia Masick. Then Natalie Sugarman and Deborah Gatone will talk to us about their RISE program. Stacy Champy will then talk about her coaching efforts to enhance MTSS, before Amy Mellow Messenger talks to us about her efforts to bring the Project Aware grant to Providence schools. Finally, we'll close out with John Crocker talking about some collaboration, sustainable staffing methods, and system evaluation efforts that he's been using in Massachusetts. After the close of our presentation portion of the day, we'll have a panelist conversation, and then we'll open it for you to ask questions of any of the panelists. Feel free to pop those questions in the chat throughout presentations, and we'll hold on to them for that last 15 minutes of our time together. Just a reminder that this is a 90-minute session, so we'll wrap up around 5:30 today, 5:30 Eastern, that is. So first, we wanted to center by talking about what a comprehensive school mental health system is. And thank you, John Crocker, for providing us with this great slide. He got this definition from the National Center for School Mental Health. And it says that a comprehensive school mental health system is defined as a school, district, community, family partnerships that provide a continuum of evidence-based mental health services to support students, families, and the school community. So when we're talking about comprehensive school mental health, that's really involving everybody that the school building touches and making sure that we're thinking of the whole continuum of students who need support to build resilience, to buffer against future mental health challenges, as well as to help students who are dealing with our tier 1 mental health challenges all the way up from tier 2 to tier 3. So let's talk about some of the resources that are out there that the Mental Health Technology Transfer Center Network has created in conjunction with the National Center for School Mental Health. We do have a link there to their website. They have a lot of great resources there. And then we also have our School Mental Health Initiative for the Mental Health Technology Transfer Center. Again, lots of free resources there to evaluate your school mental health system, to improve it, and to make sure that it's equitable and culturally responsive. One of the products that has come out of the partnership between MHTTC and the National Center for School Mental Health is the National School Mental Health Best Practices. And this is a great guide for any school, district, or state that's looking to make sure that the practices that they are using are meeting the needs of their students and families. Included in that are slideshows to help you train your staff, as well as an 8-part virtual learning series to understand how other states and schools and districts have implemented these best practices. We also want to point you in the direction of Classroom Wise, which is a really great online self-directed course for educators who don't have a background in mental health to learn how to recognize the signs and symptoms of mental illnesses and to create trauma-informed environments to buffer against further mental health challenges. We also want to acknowledge the importance of the community schools framework. We had a full panel discussion about community schools in New England, and that is linked here on this slide. It's very similar to what we just talked about with the comprehensive school mental health, that it includes partnerships that really bring the community resources into a school to meet those needs. Because as you'll hear from our presenters today, the job of making sure that we are providing the best mental health care we can in schools is really difficult to do alone. It really requires collaborations. And we wanted to point out the integrated multi-tiered systems of support, which is a really integral framework that a lot of the schools that we work with and some of the schools you'll hear from today use. And we want to encourage those who aren't familiar with the integrated multi-tiered systems of support to look into the research behind it. It takes what we already know and use in our schools about providing mental health services for students along a continuum and helps match up those efforts to extra support from the community. So you can see here at the universal level, making sure that we're providing preventative health programs and connecting to public safety services. At the tier 2 level, having full family support programs all the way from birth to 3 before our students even get to the classroom. And then thinking about our tier 3 students, really thinking about what kind of supports we can provide to the families as well. So I encourage you to check that out if you aren't already familiar with it. And I'm not going to take any more time talking about the national frameworks. We want to get into what's going on in New England. And I want to first introduce Julia Masick, who's a behavioral health specialist at the Aroostook County Action Program. Take it away, Julia.
Thank you, everyone, for being here this afternoon. It's nice to have an opportunity to kind of talk about, what's been going on in northern Maine, Aroostook County. First of all, I'm going to talk a little bit about what ACAP is and who we are as an organization. Aroostook County Action Program Incorporated is a 501c3 nonprofit organization that was founded in 1972. So this year we're celebrating our 50th anniversary as an organization. We are one of 10 community action programs in Maine and one of approximately 1,100 nationwide. When created, community action programs were charged with eliminating the causes and conditions of poverty. That mandate still exists and for 50 years has responded by offering a vast variety of social services to address poverty in a comprehensive way. ACAP serves approximately 14,000 low-income people with more than 40 programs and services in 4 major program areas: early care and education, economic development, energy and housing, and prevention and wellness. I apologize for some rowdy dogs that just came in from outside. This month of May is also Community Action Month. So if you're, in different communities that have community action organizations, you may be hearing about just some of the activities that are happening in your area. In addition to providing support and economic development, other services are included that we work with low-income home energy assistance, the LIHEAP program. We provide support around energy crisis intervention program, which is the ECIP program. We provide low income assistance program support, case management, Affordable Care Act Navigator program. We help with energy, moisture, and infiltration audit inspections, along with housing rehabilitation services. We provide work with workforce development. We support home ownership education, helping with foreclosure counseling, lead paint inspections. And then within our early care and education program, we have Head Start, Early Head Start, and child care programs that work with child care food programs. We have a WIC program that works with women, infants, and children that provide breastfeeding support, as well as we have an oral health program that helps with early care and education or early dental and oral health needs. So that's kind of in a nutshell what ACAP, our organization, as a community action program. But my role as a behavioral health specialist has been really an opportunity to begin working within our agency, but also within our community school settings. I'm, as a behavioral health specialist, it's a fairly new position within Head Start and Early Head Start, with the understanding that the needs of young children, but also supporting families within mental health and early care and education support. So I've been given the opportunity to begin working within our organization and being trauma informed. as well as establishing this lens as we work within our community, continually recognizing the 6 guiding principles to a trauma-informed approach, looking at safety, trustworthiness, transparency, peer support, collaboration, empowerment, voice and choice, and then the cultural, historical, and gender issues. This is one of our expectations, is that all training or all staff are provided trainings around trauma-informed, poverty, diversity, generational training, as well as cultural sensitivity trainings that we provide for all of our staff. Again, with the hopes of just really beginning to recognize and seeing things through different lenses. In our early care and education and Head Start and early Head Start, being trauma informed and being aware of all the needs of our children and families is an important factor. So with continual support for our teachers within our centers, conducting observation, participating in meetings to look and discussing cultural needs, and providing staff talking points throughout the year are key components of what we work with within our programs. Within my role, I also provide support in monthly supervisory meetings within our centers, providing ongoing training around trauma-informed, and also helping teachers in beginning to implement mindfulness activities within the classrooms. I also am very fortunate to get to work within a couple of our community schools. One of our schools, I'm in the program or in the schools working within a number of classrooms, providing social, emotional, and mindfulness activities. I partner with teachers and school personnel, both within the social work and principal administrative avenues, and helping again to have teachers begin to understand how important awareness of being trauma informed, but also that social emotional learning is a key component in helping to bridge the academics that our kids are working within our schools. Working on helping teachers recognize and understand that academia and social emotional learning go hand in hand. Teachers are beginning to really understand concepts, and there are small steps towards being more compassionate, kind, and caring, and having that within their school environment. The hope is that more administrative work will be open to the needs of bridging academics and social emotional learning along with trauma informed within the other schools throughout our county. I'm also cross collaborating with another program that ACAP provides, is restorative practices. And so within a couple of schools in the Caswell area, myself and the restorative practice community educator, we are conducting circles within the classrooms, as well as educating teachers around restorative practices. And we are in the beginning stages of working within our small rural areas on developing a student assistance program, and that's addressing what current supports are available in our rural areas, and beginning to develop wraparound services so that youth within our county can begin to get ongoing support within our schools. Again, specifically looking into mental health and behavioral needs that are so prevalent across the county. That's what I do in the area of Aroostook County.
Thank you so much, Julia. It's great to hear how comprehensive the services ACAP provides are and the impact you have in the early years of the children who live in that county. Now I'd love to introduce Deborah Gatone, who's a trauma program counselor at Randolph Elementary School in Randolph, Vermont, and Natalie Sugarman, who's a school social worker also at Randolph Elementary. I'll pass it on to you two.
Great, thank you. I'm Natalie Sugarman. I'm one of the clinicians that works in the RISE program. I'm going to introduce the first couple of slides, and then I'll hand it over to Deb. The RISE program was developed and created to support students in the natural school environment. The goal was to have the therapeutic supports right there in the school so that students could have regular access, easy access to that level of need throughout the day. The name RISE stands for, R is for building resilience, I, building independence, S is having success in learning, and E, engaging with others in healthy and positive ways. So our goals, we have 3 goals. The first one is to help students build the resiliency skills to increase their ability to be successful, both academically and socially. And Deb will go into that part a lot more about what we do in the RISE program. Our second goal is to help teachers build the capacity to work with all students using a trauma-informed lens and practice. And part of the success at Randolph with bringing this is that the school district offered a college level course to all the staff members. And this course was specifically designed for educators to learn about trauma, how it impacts students, and how it can affect their learning. And this was an amazing course. And it has been followed up every year since then with ongoing professional development and consultation to support staff's growth. So that's a really big part of the school's commitment to bringing trauma-informed practices into the school. And then another one, our third goal, is working with families. You know, it's very important for us to be working with families and fostering that homeschool connection, supporting them in accessing resources in the community as much as we can. And not only is RISE the one reaching out to families, I mean, teachers are really great at doing that as well. We really work together to develop that connection with families. Great, thank you. Next slide. So our primary focus is to help students develop those regulation skills. We do this by teaching them how to identify their emotions, develop an understanding of their brains and its response to stress, and developing coping skills and strategies so that they can have that successful day at the school. And for the staff, we want to continue to build on teachers' understanding of the physiological effects of the stress response on students. We want to place emphasis on building strong, positive relationship with all students. And the all is the really important, it's everyone. And then of course, continue to build on the staff's knowledge of trauma-informed practices. And lastly, we've been doing a lot of work toward helping staff take care of themselves as well. And there's a committee at the school that works on developing and creating activities to help teachers not to forget to take care of themselves. You know, what we do can be really hard, and there is a secondary effect of that trauma that comes part of being in a school system. And so really important to take care of ourselves as well. All right, Deb.
Okay, you ready for me?
Yeah.
Bear with me, because I'm a visual person. I'm trying to follow on my laptop the screens. And Natalie hit on so many of the points that I'm going to pull some pieces from the general features of the program and expand on them based on the overview, because she did a nice job of the overarching umbrella of our trauma-informed services at Randolph Elementary School. The RISE program was developed a couple years ago. Interestingly, kind of the first year that schools had some significant changes due to the COVID pandemic. So it still is in progress, but we've made so much growth in the last couple years. The RISE program itself is a program, and it's also an approach. The program consists of 2 master's level clinicians, Natalie and myself, who both have a background in mental health as well as mental health work in the educational setting. We've actually also worked very significantly in the mental health field in the Orange County area where Randolph Elementary School is. So when we came back to work in the school in this program, it felt a little bit like coming back home to where we started off our work. We work very closely with our behavior response and our student support team because our philosophy really is that in order to increase student success for all students, like Natalie said, we need to have a system that works very closely together so students have that predictable response. We come from a place of a stress reduction skills building model rather than a misbehavior model at our school, which is trauma informed and an extension on that. We believe that everyone, including the adults in our school, needs to have opportunities to learn about their own stress response and co-regulate and support the students in our care. The RISE program itself is a classroom embedded within the school, but it's not an alternative classroom setting, nor is it a self-contained classroom. It is a fluid environment where all students are welcome to come and go throughout the day. We have students who have scheduled break times. We have students who have as needed breaks. We also have individual and group counseling sessions where we work on skills. Some kids are connected with us and check in with us periodically throughout the day. And then we may, touch base with them once in a while for periods of weeks, and then they might come see us a little bit more for processing or support depending on what's going on in their life. We use a social thinking model and a model that's based on brain science. We do a lot of teaching kids about stress and about what stress feels like in our bodies. Oh my goodness, my Alexa just answered something. I'm sorry. We do a lot of skill building around understanding how stress feels. We use zones of regulation as our kind of foundation and format for our curriculum, and we expand on that using the techniques of Dr. Bruce Perry and Dr. Dan Siegel, the whole brain child and brain development. We really strive for a safe environment for all students where they feel safe with predictable routines. Relationship is really important so that they know that there's people there that are there for them. We do individual and group counseling skills building where we teach regulation skills and practice them so that they can carry them back into their environment, into their classroom, and utilize them as needed. We do individual and skills building, but we also connect because it's with the local mental health agency and community supports. And family, like Natalie said, is very important. Being mental health workers within a school system, we have some flexibility to be able to go out into the community, to go to homes, to bring kids home from school when they need it, to have conversations with their parents. Parents are welcome to connect with us in the school building as well, because it's really important to offer them the same support and skills building in order to provide healthy, safe family systems. We also connect and coordinate with the staff in the school, as well as community partners. We have flexibility in the summertime to do community connections and to develop activities for consistency and continuity for the students over the summer. Next slide.
And you've got about 15 seconds left, so I'm not sure if you want to maybe showcase some of the tools that you had.
Yes, I was going to say that. Next slide we can skip. So the tools that are listed on the following slides are self-regulation tools that we, at the start of the school year, believe that universally all classrooms should have to support students in regulation. We did a training at the beginning of the year for all the staff in how to teach children how to use those tools appropriately, how to have calming spaces within every classroom that kids could access, so that all students have access to these supports for stress reduction. I don't know if we want to do the final slide. I can't see it in front of me, but I don't know if you want to do the short video. We don't probably have time.
No,
So
it's
if
pretty
you'd
short.
like to,
It's a very short
okay.
video, and it's a good one.
Okay,
It is.
so just
Okay.
a preview to this. When we did the training for staff on how to teach these skills to students and use the tools, we had some of our students who have been in our program become teacher trainers, and they agreed to do a video to teach a technique to their teachers. And the student that is showcased in this video did a previous video that he references about breathing techniques, and he taught his teachers how to do mindful breathing because he had learned that in our RISE program. When we asked him after the video was done, what helped him to be calm, because he's made so much progress, he wanted to do a second video, and this is the second video he did. And I think it really captures the growth of the student and the growth of the kids we've seen in RISE during a tough time over the last couple of years for everyone. So go ahead and play it.
Yes, I am so sorry. Zoom has updated and I did not update it to play the sound since the last time we had a webinar. So I'm going to invite one of my colleagues to get the link to that and put it in the chat so folks can view it later, or you can view it when you get the slideshow. I really apologize about that. It is a very great video. Oh, were you hearing my sound?
Yes.
Oh, great.
I learned this from RISE. The Sugarman, Mr. Tone, and the whole school helped me learn so much, and you also helped me keep calm. And these past 2 years, it's been hard with all these masks and the virus, but I'm happy to say that wish you luck on this breathing and stay calm.
That's great. Thank you so much, Deborah and Natalie.
You might know me.
That was really great. It's wonderful to hear all the great things that the RISE program is doing. Now I would love to introduce one of our Childhood Trauma Learning Collaborative Fellows, Stacy Champy. She's the MTSS District Coach at Manchester Public Schools. Take it away, Stacy.
Thank you, Dana. Hi, everyone. Thanks for joining us this afternoon. I am going to talk about how we are addressing comprehensive school mental health through a systems approach in my district. So coaching is an important, through research, it shows us that coaching improves an educator's practice just as much, actually more than decades of experience. And this is from research that Dana has shared with us. And if you go to the next link, coaching lessons from this digital learning project shows that the coach and the educator or the teacher, they need to have time allocated for coaching and to engage in those activities. The coaches also must have access to ongoing professional development to improve their skill set and continue to keep up with current practices in the field. And the district needs to dedicate funding for coaching positions so the schools can be supported with ongoing coaching and technical assistance from the district level. And this will then help to create a sustainable model in the district and support the schools. So where did we start in my district? We have 21 schools, and we wanted to ensure that we had a consistent approach across all schools when we began to coach them on setting up multi-tiered system of supports. Dana, could you just go back one slide? I think it jumped ahead. There we are. So first, I was hired as a coach for the district, but my first task was to set up the systems and how we were going to approach coaching the schools. So I needed to draft a plan on what it would look like for a strong tier 1 or school-wide approach, which incorporated school-wide mental health, and also targeted tier 2, 3 approach. So I began drafting that plan and testing that in a demonstration or a pilot school, so we could um, see what was working and what wasn't working and come up with a solid draft. And next slide, please. So the components that we put in this this coaching plan for tier 1 include the following components. And if you just click through, I think they'll appear. There we go. Database decision making is always on any tier that we're working in. Positive behavior supports. We're also looking at behavior as well as school-wide mental health, social emotional learning. We're also, again, looking at school-wide mental health, both prevention and promotion. We want to align any of our community partners at tier 1 with the work we're doing. Family engagement is important, obviously, at tier 1 and all tiers, and targeted professional development for all staff. Universal screening, which we're not quite there yet at my district, but we are almost at that point where we're ready to bring something that in. And we want a clearly articulated referral process so we know when students should be referred to targeted or intensive supports, what that would look like. And then when drafting our plan for tiers 2 and 3, more targeted or intensive supports, we wanted to make sure that we included, again, database decision-making, that we coordinate our community partners who are in our schools at these tiers, that we're providing targeted professional development for everybody, community partners and staff, and that students don't just remain in an intervention if they access an intervention, that there's a clear criteria for entrance and exit, and that we match students with the appropriate interventions for what it is they truly need support with. And as I mentioned, I'm working in a demonstration site, and this site was chosen because there was a great need in this school. We had a high turnover with administration. We had 6 administrators in a matter of years in this school. There were a high rate of suspensions. It was identified as a school in need of improvement in our district. And there's a very diverse population in the school as well, and a need for family engagement and a lot of work to do in this school. So we chose that as our demonstration site. And this is the model that we're working with. We chose a few evidence-based practices across all tiers. Again, these were just mentioned where we have positive behavior supports, school-wide mental health, a really strong focus on tier 1, school-wide. All students always have access to tier 1, no matter if they have targeted or intense interventions. We have a check and check out program and small group counseling with our community partners also working in the school, and then individualized supports. Still working on that family engagement piece, and parent training and collaboration is something that is on our future list. We're not quite there yet, but we're working on that. And looking at the comprehensive school mental health model, the 4 quadrants here really tried incorporating in this blueprint that we've drafted. And the first one, prevention, school-wide mindfulness is done every morning. Right after morning announcements, eventually this will be student-led, but we wanted to make sure that it was built into the daily practices in the school. Staff wellness is also an area of focus. We have a school wellness counselor who specifically targets staff wellness to help with secondary traumatic stress for staff. And we have an evaluation plan to target what it is we're implementing. Are we doing these practices with fidelity? And what are the outcomes of what we're implementing? We want to make sure we evaluate that and continually if you look at the next slide, that we're continually monitoring what we're doing. So our tier 1 team in the first year where they're working and planning in the school, they have some baseline data, but as they begin implementing, we're looking at our office referral procedures, we're looking at climate surveys. We want to know if we're having an impact around all areas, especially school-wide mental health. And then the targeted team also is looking at that early warning data for prevention to make sure that we're catching students before problems become chronic or more severe. In the second quadrant, supporting youth, we want to make sure that all students always have access to tier 1, and we can't really support our youth unless if we're supporting our staff. So we've built in some tools into our coaching guide to coach the teachers on tier 1 and make sure they have some checklists and things they can work through to know that they've supported the youth at tier 1 to the best of their ability before referring them. And then if they do need to refer them for additional support, that we have interventions in place that are targeted to support these youth, either school or community-based. Okay, I'm going to move a little quicker. Protective factors, targeted professional development for staff, and that we work with our city health department, and we have a collaboration with them. And to build resiliency, the last quadrant, we have a dedicated space in every classroom for students to self-regulate, and we make sure that we're teaching our school-wide SEL curriculum with fidelity. And youth, home, community, everybody, we want a voice at the table. That's the center of this compassionate school mental health model. And so we've made sure that we've built into our model a space for everyone at our table on all of our teams to work collaboratively together. And again, mentioned this blueprint that we've drafted. So I have a train the trainer model. My district is hiring additional coaches now where I can take this draft and train them so we can reach schools more effectively, because we want to make sure that we're setting up a sustainable model that will be ongoing. And so here I am training the coaches who then train the schools, and the schools have a coach who then work with the school-based teams. And all of this is supported by our district and community leadership team. We want to make sure that we're addressing any systems level issues between district and the schools, and that there's this feedback loop with the coaches, so we can continuously look at our district data, our community data, and see where we can target areas of support for school-wide mental health, targeted areas when we have grant funding, any funding, that we can make decisions with all stakeholders at the table with using a database driven approach that again has this feedback loop, so everyone is being supported in this model. Okay, I paraphrased away.
Thank you so much, Stacy. This is such a great model that we hope that other schools and districts can replicate. So now I'd like to introduce the Project Aware Coordinator for Providence Public Schools, Amy Mellow Messenger.
Hi, everyone. My name's Amy Mellow Messenger. As Dana said, I'm the Project Aware Grant Coordinator in Providence, and I am also one of the lead social workers here. So Project Aware, this grant is a grant through SAMHSA that was awarded to our State Department of Education. We call them RIDE here, and then given to the Providence District. We have 5 pilot schools that have been identified for Project Aware out of almost about 40 schools in our district. And the goal, our long-term goal, it's a 5-year grant that each of our pilot schools will have a documented solution-focused system that supports and empowers all educators and partners to help children and families access mental and behavioral health support needed to thrive in school, at home, and throughout life. Some of the metrics that we're required to report out on as part of the grant includes the number of students that are screened for social, emotional, or mental health needs, as well as how many of those students that were screened have been referred for service and how many actually are receiving that service. And this tool that we utilize in that process is the SHAPE system, which has been referenced earlier in this presentation. So one of the ways that one of the strategies we're using to meet the goals of the grant is by partnering with those community agencies. We partner with two large agencies in Providence, CYC and Family Service, in order to provide clinical services to our students right within the school building. And so that really, in an attempt to reduce some of the barriers that students have in getting those outside clinical services, we house the clinicians in our school building. So this is just a roadmap that we use when we're training school staff. We've presented this to parents as well and community providers, that when a parent, teacher, staff notices that there might be some additional needs that the student has, he or she can refer the student to a student support team within the building. Also, students are identified using a universal screener. And then from there, the mental health agency completes the necessary paperwork with the family and makes contact and coordinates that intake process. Of course, the families have a choice whether or not, this is not mandatory, they can choose to access those services or not. And then they're able to provide that clinical service, like I said, right in our school buildings. We used pieces of the grant to provide these services to students who are uninsured or underinsured, which has been helpful as well in reducing those barriers. Another success of the grant has been our partnership with the Parent Advisory Council in our district, as well as the Family and Community Engagement Office. Through that office, they have something called the Parent University, which offers virtual sessions to parents on topics that might be of interest to them. So for example, this month, because of mental health awareness, we have a lot of presenters from our community partnerships around mental health, social emotional wellness, and those types of topics. One particular this wellness spotlight that we had in February of 2021 was really successful. We had over 2 different sessions. We had a daytime session as well as an evening session. We had nearly 400 families log on. It was offered in both Spanish and English, and we had spotlights from 4 community agencies, which you see on the flyer that's on the slide, and really a lot of good questions and interest from parents, and the ability for parents to connect with those agencies following the spotlight to get more information and engage in services. Another thing through the grant that we've concentrated on is increasing the professional capacity of our employees. So for example, last summer, and we will be doing the same this summer, offered a series of professional development opportunities to our school-based mental health providers. And we invited those agencies too that offer services in our school building for our students on a variety of topics. We were able to offer CEUs for social workers, PLU, professional learning units for other educators, and staff were paid as well, compensated financially to attend. Some other partnerships with community agencies that we have are outlined here. Unite, I've spoken about a few of them. Unite Us is a digital platform, a referral system that we're starting to roll out in Providence. And it's interesting because a lot of the data that SAMHSA requires us to report out on Project Aware is captured right through that electronic referral system, which hopefully we can increase the usage within our district to be able to do that. the Let It Out campaign. We have, we're actually rolling that out in Providence. On next Wednesday, we have a statewide event that we've invited other districts to, and our community providers and our colleges and universities. That's a mental health awareness campaign. Initiated the state level, rolled that out, and then we're rolling it out here in Providence, like I said, next Wednesday. Rhode Island Student Assistance Services, they have student assistant counselors in many of our schools at the secondary level to address substance use awareness and some services related to that. And then we've also partnered with Rhode Island College, Providence College, and a few other universities and colleges that are local for social work, school psychologists, and licensed mental health counselors in order to create a pipeline of employment to our district, hopefully. So one of the partnerships with the Rhode Island College includes creating this integrated behavioral health team. So the concept is that the college has 4 students that will come as a team to do their internship within our schools. There'll be one, the school psychologist internship, a school social worker, a LMHC student, and the school counselor. They will come as 4 students that are placed within one of our schools that already has a strong functioning school-based team in order to learn to complete their internship, to learn how to partner effectively as a team, and to hopefully, like I mentioned before, create that pipeline of employment into our district. The grant has also been able to provide some resources to our mental health professionals, some curriculums that you see here, zones of regulation, super flags, some social emotional books that we put in our libraries throughout our district, our school libraries, sensory items. We've paid for memberships to School Social Work Association of America, National Association of School Psychologists, and American School Counselors Association. We've also created a district wellness office. So there's been some reorganization. Within our wellness office is our school nurses, our gym, physical education and health teachers, our school counselors, school social workers, and school psychologists. So even at a district level, we're able to function as that district level student support team, which we'd love to see replicated and is replicated in many of our schools.
Thank you so much, Amy. You're doing such amazing work in Providence, and it's clear that all of the community partnerships are an integral part of this work. So thank you so much for all that you do and for sharing that information with us. Next, I'm going to pass it on to John Crocker. He's the director of the School Mental Health and Behavioral Services at Methuen Public Schools. Oh, and I'm not sure what just happened.
Oh, I just snagged the sharing because I'm gonna demo some stuff. But yeah, thanks, Dana, and thanks for everyone else who's presenting. I am the director of School Mental Health and Behavioral Services for Methuen Public Schools and the founder and director of the Massachusetts School Mental Health Consortium. And today I'm going to be sharing a little bit about 3 buckets of work. The first is the collaborations that are happening across the state. One of those collaborations is this consortium. The districts that are colored in are the districts that are part of our consortium. We have about 160 districts that are part of the group, and we started this about 4 years ago. The effort was an attempt at replicating some of our lessons learned from our participation in the National Quality Initiative Collaborative for Improvement and Innovation Network, which is really a learning collaborative with another 11 districts across the country that was an attempt at building comprehensive school mental health systems. And we felt really great about the work that we did with the National Center for School Mental Health and what we were able to develop. But we also recognize that, the districts around us really needed a lot of support and guidance and resources to be able to get this work off the ground for their districts. And we felt like the onus was on us to share that, that wonderful experience we had. So the consortium tried to replicate the experience of that learning collaborative at the national level for the state of Massachusetts. Here's our purpose and intent. Really, if I could summarize, it's about resource sharing, collaboration, and lots of professional development and coaching to advance school mental health implementation. Everything we offer is free. We just want districts to be able to feel resourced and supported in developing systems of support for kids and implementing quality and evidence-based therapeutic care for our students, inclusive of substance abuse resources and services, and all the way down to tier 1 with SEL and mental health literacy. Some of the things that we've done across Massachusetts, we've engaged hundreds of school mental health staff and educators across more than 160 districts, lots of professional development, lots of coaching. Right now, MASMHC is coaching about 20 districts to implement universal screening practices across Massachusetts. I'll show you a couple other initiatives coming up. That one's pretty recent. We've developed resources and distributed them across the state. Lots of implementation support with districts to try and build their capacity to implement evidence-based mental health services and supports, and build teams to promote sustainability of these services. We've also really taken an approach where data is central to the work that we do. So promotion of universal mental health screening, measurement-based care practices, collection of data around the system, which I'll show you the SHAPE system in a few minutes, which is really a wonderful tool to measure the health of your mental health system, and has some data relative to that implementation that you can use to drive action planning and efforts to implement quality stuff. We've secured a lot of partnerships. We've given money back to districts that has been allocated to the organization through our mini grants program. And we've done a fair amount of advocating for a variety of different bills that focus on workforce development and improving access to services. Here are some of our partners. We like partnering an awful lot, especially with our state partners at Department of Elementary and Secondary Ed. We have a great partnership with Mass DMH. Thriving Minds is a partnership with Rennie Center, which is a education and policy research institute out of Boston, Center on Child Wellbeing and Trauma. If you come to our webpage, you can take a peek at some of the stuff that we're doing, some of the current initiatives that we're undertaking. Thriving Minds, I just mentioned. Really, it's a learning collaborative and professional development series. We're also partnering with the state to run the Collaborative Improvement and Innovation Network for Comprehensive School Mental Health, which is focusing on developing comprehensive school mental health systems in a handful of districts in partnership with the National Center for School Mental Health and DESE. We are concluding our School Mental Health Leadership Institute actually tomorrow, which was an attempt at developing the next cohort of clinical leaders for the state. There's a dearth of clinical leadership across the state and nationally. And in the absence of clinical leadership and supervision, we really are not doing ourselves any favors in terms of advancing the field in terms of practice and systems for school mental health. So just a quick peek at a couple of our initiatives. We'll head back here. I want to shift to how we're doing work in Methuen as a comprehensive school mental health system to respond to the needs of kids and really continue to advance our efforts to develop our comprehensive school mental health system. We cared about these services and supports way before the pandemic. So this is our attempt at doubling down on the things we did pre-pandemic because we know they worked. So we've developed a strategic response to the needs of our kids. Priority 1 is expanding our universal mental health screening program. We already screened 3 through 12 before the pandemic. Now we're a K-12 screening district. We screen for things like anxiety, depression, post-traumatic stress, substance abuse. We use measures like the GAD-7 and the PHQ-9 that look at symptom presentation, and we monitor those students who need services and enroll them in evidence-based therapeutic care. We had a pretty robust cognitive behavioral therapy group program prior to the pandemic. We're expanding that both in scope and frequency and ensuring that our kids have access to it. And we're implementing a cognitive theory-based SEL curriculum K-12. to ensure that we are engaging in prevention efforts and giving kids the skills and attitudes and knowledge that they need to be able to effectively manage stress and navigate difficult situations that might cause them to be in distress. This is the theory of change. If we engage in early identification through screening, then that is a prevention activity. We're not waiting for crisis and diagnosis or the 8 to 10 years that it typically takes for a kid to enroll in services after the onset of a mental health problem. We're providing intervention through proactive and preventative services. And we're providing all kids with the skills that they need to find success. And that's a prevention activity unto itself. Here are a couple of resource guides. This is part of your e-gift basket for attending today. There are a ton of resources around universal screening that I think would be just helpful to check out and takes the guesswork out of implementation. I am going to demo very quickly for you the SHAPE system. This is the landing page for the SHAPE system. Can you all see that? Give me a quick thumbs up. Yeah, all right. The school mental health profile in the SHAPE system, this is really a resource mapping tool to be able to understand the kinds of data systems and services that you offer, the staffing that you have available, and the services and supports that you offer as a district. The mental health quality assessment this is really measuring the health of your mental health system. If you take a look at the summary report, it's going to give you a really strong understanding of the domains that you need to focus on, and you can dial into each domain and get some very specific components of practice that you might want to focus on, and also some bright spots that maybe you want to double down on and leverage effectively. Let me get out of here real quick. I want to show you a couple other things. There's a resource library, pretty great. This one people tend to love. When I talk to people about screening, they typically tell me, I have no idea what measures are out there. Well, this is a screening and assessment library that you can leverage through the SHAPE system. You need a measure for anxiety. It has to be for screening. The kids are 11 years old. It has to be offered in Spanish. The student's going to fill it out and it has to be free. Well, there you go. There's a bunch of measures at your fingertips that you can use, and you can drill down to what that measure looks like, access to it, lots of scoring and interpretation information. Treat this as PD for your staff to be able to get ready to implement. I'll move on from the SHAPE system and just share with you our staffing model, which I think is pretty important, but I want to start the staffing model conversation with this reflection on the staffing grid that was, this is an activity that I do with districts an awful lot. So this grid represents a bunch of districts filling out their own individual grid, and this aggregates all the data. So what you see here is across the top, those are the roles, and across the, each row represents an activity that I would expect a school mental health professional to engage in. What you see here is the aggregate results from a bunch of different districts filling out their own individual grid. And what I see here is absolute chaos and a complete and total lack of consistency across staffing models. What this ultimately leads me to believe is that it is the onus of the local district to define roles for every single one of these categories, these activities that you as a district didn't check off, someone else did, and vice versa. So I think it's important that we recognize that our school mental health staff are perhaps not being leveraged as effectively as they could be, and there's an opportunity there to develop a staffing model that's more comprehensive. This is our attempt at that staffing model. We feel really strongly that we want to avoid parsing out domains of need and tiers of support. So essentially what we're saying is, if you want to work in our district in our comprehensive staffing model, we don't care what license you have, as long as you do have a license and you're enrolled in, or you have enrolled in and completed a master's level training program that focuses on counseling, mental health practices. And we will continue to support you in development of your skills. We can't assume that people coming out of their master's program are done with their learning. It's a profession, you're learning forever. I would offer this as the posting that we have put out there. It points very heavily at, you're all going to have a caseload. It will be evidence-based practice across all domains of need and all tiers of support. And we will leverage your specialization by giving you projects that align with the training that you've engaged in. So if you're a school psych, great, we'll leverage your testing ability with some projects that focus on that. If you're a school counselor, we'll leverage your specialization in academic and post-secondary planning with projects that focus on that. All right, that's all I got. Thank you so much.
Thank you so much, John. We really appreciate all of the great information that all of our speakers gave us today. We're going to move into our panel discussion now. So if you have any questions for the panelists while we're starting our discussion, please put those into the chat for us. But I want to start out with a question that I have for everyone. I've heard a lot about professional development. Almost all of you mentioned the importance of professional development in your comprehensive school mental health system development. So I'm wondering why the professional development for teachers is so important for student mental health.
I can start. If we don't invest in professional development for all our staff, then we're ultimately not leveraging the entire faculty to be able to move the dial on school mental health and the well-being of our kids. Tier 1 means for all by all. It's universal, and we should have our staff trained up in trauma-sensitive practices and delivering SEL, being able to respond to the needs of kids in the classroom. It's a joint effort, and if we don't, SEL and mental health literacy can't be the job of a couple people in the counseling office. It has to be all hands on deck.
And I can add to that, just saying that it's really important that the staff have relationships with students and that they be genuine and having an understanding of what we're asking them to implement from SEL or behavioral strategies or mental health practices. They need that targeted professional development to understand what they're doing, to be authentic, to be genuine, to develop those relationships with students.
And I would just add to that, that it provides teachers some tools and ways of being able to implement those ideas within the classroom. So it gives them some of those talking points or things that they can pull to help really enhance and help the students grow in their social emotional learning, their mental health areas as well.
Great. Yeah, I think a lot of folks think that the school mental health professionals come in, they've got professional training, so why do they need to keep learning about this? But thank you all for also pointing out the importance of professional development for everyone in the school building. So a lot of you also mentioned families and the importance of families to help support not only the work that you're doing in the school building, but the effectiveness of what the students are learning to carry that forward. Can anyone talk a little bit more about how you work with families? I know that Amy, you mentioned the parent university. Can you talk a little bit about how to engage parents and get those parents in the door for those types of activities?
So in our district, we have a family and community engagement office that the director of that office and myself have worked closely together. She's asked me, as well as some of the other mental health, school-based mental health providers in the district, to attend some of the parent advisory council meetings, and really with the intention of us just listening to the parents, not necessarily offering any feedback, just really being able to hear what their concerns are, and then brainstorm next steps in order to address some of those concerns. So from that, we put together in collaboration with our community partners, some of those parent university sessions and at the district level, and then to be able to take it down to the school level, what's going on at each school. Because we have so many in Providence, it's a little different depending on the grade level and the context of the building, but to take that and put it down at the school level.
Thank you so much. Stacy, I'm curious to hear about, you mentioned the family involvement in the advisory boards and the decision making. Can you talk a little bit about how you all tackle that?
Can you explain, what did you mean, the advisory board?
Oh, sorry. Oh, I'm not sure what you said in your presentation, that you bring families and students to the table to help make decisions.
Yes, I'm sorry. Yeah, when we're setting up our school-based teams, we want to make sure that we have family voice on our tier 1, our school-wide team, or if it's secondary schools, student voice as well. So it's just, if we create a system or a model in the school and we don't have that family voice and we just share out and say, hey, this is what we're doing, the buy-in is not going to be there as much as if they're part of creating their school climate and culture and the practices that are going on. We want that student voice. We want that family voice. We want to make sure that we're representing different cultures and we're getting their feedback as well. So we make sure that we invite families on that tier 1 team to be part of the work that's done.
In our early care and education program, all of the kids that come through our Head Start or early Head Start are offered a family coach, so that every family has an opportunity. It's voluntary, but it's an individual that they can reach out to, access services for. In addition, we have our policy council is made primarily up with parents of children that attend our Head Start and early Head Start. So they're part of the policy making decisions. They hear when new policies are coming through, so they have that insight and understanding. And then they're also a voice in, their thoughts and ideas around that within our early care and education program.
Great. Natalie, could you or Deborah talk a little more about the family engagement piece with the RISE program?
Yeah, so we have caseloads, each of us, and so we are responsible for reaching out to our the families that we're working with and working really closely with the teachers who are also actively engaged with the families as well, which is nice. So it's not just me calling, but we're really working as a team. And we just try to do as much communication as possible with good news, and sometimes it's the hard news, and just to build that connection with the family so that they trust us and answer that phone when we call.
Right. And I don't know if you can hear me. I don't know if I unmuted myself. Tapping into what Natalie said, very much like our students, our families, especially during a period of time when we didn't do as much face-to-face, need to kind of know how to navigate a group of people in an environment that wasn't always feeling comfortable for them. So that relationship was really important. And sometimes something as simple as just having kind of meeting families where they're at, meeting them out in the community if they'd prefer to do that, but also setting just a time. Like I have one mom who didn't know who she was supposed to call for various kids in her family. So we just set a phone call check-in every week at the same time, because that worked for her to know, okay, this is my voice time. I have a chance to talk about what's going on. And I know that there's one person who's going to be there for me to keep it predictable. So it's really, like someone said, it's just the respect and giving them the voice and the opportunity to be heard, because they're very important in the team.
Great. And John, what about at Methuen?
So we've developed a parent-student advisory council for our mental health initiative, which focuses on giving parents and students a voice when it comes to what we implement. If it's not designed for them, then it doesn't work for them, then what's the point? We've also engaged in some work recently to develop marketing and advertising materials for parents, which was a little bit strange at first to work with with an advertising firm, but we realized that it was an investment in access to care our parents and students don't understand what we have to offer and the services and supports that we are championing, then ultimately they don't get accessed and they don't get to benefit from them. So we've developed 1-pagers, 2-pagers for parents and students to talk about the services that we provide. We've developed a new web page that outlines how to access services and how to make connections with our counseling staff. So that's allowed for us to really improve the connection with parents and students around, you know, what we're all about.
That's great. That's a wonderful idea. Sounds like everyone feels like family voice and engagement is a really integral part of really making this work. We're going to again invite the audience members to type any questions in the chat or raise your hand. I do have one from earlier in the presentation, and this one was directed towards Julia, but might apply to other folks as well. Josephina was wondering if the cultural training and cultural sensitivity work is ongoing or a once a year practice for your district, Julia?
Well, in our staff training, we provide it once a year, but it's the idea is those conversations can continue ongoingly, particularly in classrooms, if there's cultural needs and ethnicity, to be aware of what's happening daily in the classroom. It's provided by an outside individual from one of our Native American organizations. And so it's kind of guided more around specifically around Native American culture, but that doesn't mean it just stops at those trainings. You provide the training once a year, but it's the idea is to continue to have those conversations ongoingly.
Great. Does anyone else want to speak about any cultural sensitivity or equity trainings going on in your districts? That's okay. All right. Well, let's go on to another question that we have. I'm curious about your efforts to ensure sustainability of your school mental health systems. We heard from John about the sustainable staffing models. How about others on the panel? Do you have anything that you're doing to make sure that the impact that you're having now continues on down the years?
I just wanted to reiterate doing that evaluation piece at the school level, at the school with the school teams, looking at that data on a regular basis with the coaches, making sure they're pulling that and bringing that back to the district. We have a schedule that we're following to make sure it's not like the start and stop initiative, but we have this evaluation piece on a schedule, regularly reviewing, the district team reviewing the data as well, to ensure that we have that sustainability, that accountability, and that we're using that to make decisions.
I would add, when we're talking about sustainability, I think we're also talking about funding. We're talking about buy-in from our stakeholders. So we really undermine our own efforts to promote sustainability when we don't come to the table with data. It has to be the case that we are collecting outcome data relative to our services, that we are showing the need, the prevalence of need within the district, and what the impact is of the services that we provide. And one of the ways that we do that is we have to engage in good psychosocial measurement. It's not the case that that we can come to the table and say, I think Johnny's doing better. He appears to be doing better. We would never accept that from a healthcare provider as a report out on well-being. So measurement-based care practices, things like psychosocial progress monitoring and being able to actually show the impact of cognitive behavioral therapy on a kid, that's something that we have to engage in. And unfortunately, only about 20% of all providers across all contexts engage in measurement-based care practices, which is pretty abysmal. We have to get better at collecting and using quantitative data if we're going to be able to sustain these programs and these services, because we're often the first on the chopping block.
Very well put. Does anyone else want to weigh in on the sustainability issue? All right, we have a question from Jamie. It's a really good one. She's wondering how to get these types of comprehensive mental health systems and services in California. She's a single parent of 2 teenage girls and a nurse, and is tired of having to throw a fit to be heard. She feels helpless, and sometimes with no support from the school. I did pop into the chat a link to an advocacy toolkit that we just published. As far as from our perspective, we know that it can feel really, really, really frustrating to be alone, and connecting with other parents in your district, in your state, around the nation can be really helpful. And we hope that that toolkit can give you a few ideas of how to reach out to people who are decision makers and can use data and stories to convince them that these are really important issues that need to be addressed. But I'm curious if any of our panelists have more advice for Jamie on how to get her voice heard as a parent.
The Office of California Surgeon General has a lot of links. I don't know if I can put that link in the chat or not. Nadine Burke Harris is part of that whole site. So let me put that link in there. If you go on there, there's a lot of links for parents and families around school mental health and services, and who you can reach out to. So I will add that in now.
That's great. Thank you so much, Stacy. We have time for just one more question. So I'm curious, what is next in each of your school mental health journeys for your districts or communities? If we could just each quickly answer what your plans are for the future, that would be great.
I'll jump in. I'm expanding in the elementary schools, 4 more schools next year, coaching. We're hiring 2 additional people to work with me, and we are beginning work in one of the secondary schools to work with students, student voice in the secondary schools to inform our model beginning there.
I'll go second. So I think through our partnership with the mental health agencies in our schools, we're really taking a look at what's worked and what we could do a little bit better. And I think one of the areas is being able to offer families a continuum of services and not just that clinical piece in the school setting. And so as we write a new RFP over the summer, we hope to include more options for families.
I believe in our organization, at least through 8CAP, is to continue to address and identify those needs and with the little people and providing support with families for those particular needs. We follow the pyramid model. So a lot of the challenging behaviors, we are continuously looking at, but becoming more insightful and helping our families recognize those needs, as well as partnering with outside organizations. And then the other component with working within our community schools, the hope is that continual work on developing social emotional learning toolkits for teachers and helping to administration to really see that there's a need for school mental health and how we can just start moving towards bringing in more ideas and programs that can really benefit the kids in our communities.
Deb and I are in a very small program in a school, a rural school district, but we're in our 3rd year, and we've been making a lot of gains every year. And Deb, please feel free to join in on this, but we are definitely growing every year, and we're working with the other supports within the school system to see how we can better work together and serve more students, because our caseloads do get full quickly, and it just seems like a lot of students need that level of support, so that's tricky.
Just to add to what Natalie's saying, we have quite a few new teachers coming on next year. We were talking today about looking at the universal, targeted, and more intensive support system within our school, but also within our school in collaboration with our mental health agency, and how we can work together. We can kind of define our roles and be more coordinated. The other piece that we've been, trying to figure out over the last year or so is coming up with an evidence-based SEL program that we can universally use school-wide, and also how we can do measures of outcome and success with the RISE program, as well as our overall support system within the school, how to really measure some of the good work that we're doing, because we can talk for a long time about the good work and the stories that we hear from the families or from staff, but we really want to have data that shows that we've made the progress we believe we have.
We're gonna keep monitoring our strategic plan, expanding screening. I think we're investing a lot in professional development through the Beck Institute to improve our cognitive behavioral therapy supports. Also, I'm going to be engaging in some work with, hopefully with Stuart Ablon to get collaborative problem solving into the hands of our teachers and staff, which will be an effort to improve our tiers 2 and 3 for behavioral supports, and continue to expand our use of data to find kids. And yeah.
Great. This is so exciting to hear about all of the wonderful things you all are doing. And we really want to thank everyone for sharing such great information. I'm going to pass it back to Martha, who's going to just review a few of our resources, and just know that you'll get this slideshow with all of the resources our panelists shared, as well as what Martha's going to go over.
Thank you very much, Dana, and thank you so much to all of our panelists. We really appreciate your time today. I want to tell you a little bit about some of our resources. We offer a number of free resources on our website. All of these resources are linked in the slides, which you will receive at the end of the presentation today. We have an extensive library of products and videos on a variety of topics, so please check it out. And we're also very pleased to announce the launch of our new public awareness campaign beginning next week, which is called Take Heart, which focuses on enhancing trauma-informed collaborations between schools and community health providers to support students' mental health and well-being. So we have a lot of information on that topic, including information and guided activities throughout the week next week. And that's all available on our brand new website, which again is linked in the slides. So we hope that you will visit and let us know what you think. We also have a comprehensive online course called Cultivating Compassionate School Communities that Respond to Trauma Effectively. This is a free self-paced course that offers information and resources to support many of the types of initiatives that we've heard about today, as well as other important school mental health topics. So thanks again for joining today's webinar. Our funding does come from the Substance Abuse and Mental Health Services Administration, which requires us to evaluate our services. I'm going to put a link to a very short evaluation survey in the chat, just a couple questions. You can also use your phone to scan the QR code on the screen, and you will also receive this via email. Let's see, you will also receive a copy of today's slide presentation as well as the video. And this follow-up email will also include links to get CE credits and participation certificates. So we really appreciate your anonymous feedback. For more information, again, questions about CEs or certificates, please contact us at the New England Mental Health Technology Transfer Center at newengland@mhttcnetwork.org. Please also stay posted to our website, which is listed on the slide, for links to the video presentation and related slides and other information. And please subscribe to our newsletters to learn more about resources to support mental health in schools. For questions about this session and our work, you can contact either me or Dana at our email addresses, which are up on the screen right now and in your slide presentation. We want to thank you so much for joining us today to hear about the amazing school mental health work in New England. We're very grateful to our presenters and our participants for continuing the compassionate work that you all do on behalf of this region's children. So thank you so much and have a good afternoon. Take care.